Good morning, everyone. Thank you for joining us. We'll give it a couple more minutes to get started. Thank you. Good morning, everyone. Thank you for joining us. My name is Jocelyn Rubio, Director of Collaborative Programs at Alzheimer's Orange County, and I oversee the Orange County Aging Services Collaborative, also known as OCASC, and the Orange County Strategic Plan for Aging, also known as OCSPA. Again, thank you so much for joining us today. Thank you for joining the Healthcare Transitions for Medicare and Medi-Cal Beneficiaries webinar. Next slide, please. Now for some housekeeping information. This webinar is being recorded and will be available to all attendees in case you would like to go back and reference any of our slides, resources, and other materials. You have all been muted by our webinar administrator so we can avoid any unnecessary background noise. Your audio, how loud we sound to you, is controlled by you. You can adjust your volume on whatever device you are watching us on. Next slide, please. Thank you. What you are seeing now is a screenshot of the Q&A box. During the presentation, you will be able to submit any questions for our speakers through the Q&A box. We will be reviewing these throughout the presentation and will ask the questions of each speaker at the end of the webinar, once all speakers have presented. Please remember not to wait until the end of the presentation to ask your question, as we will be gathering these questions for each speaker throughout the presentation. Next slide. Thank you. And here is a snapshot of today's agenda. We have 5 amazing speakers who will be talking about the transitions and resources for Medicare and Medi-Cal beneficiaries, and we'll conclude with the Q&A and closing remarks. I will now pass it on to Carolina, who is one of the co-chairs of the OCHI OCSPA Healthcare Committee.
Thank you so much, Jocelyn. Good morning. My name is Carolina Gutierrez Rijao. I'm the Director of Preventative Mental Health Services at the Council on Aging Southern California. We will get started. Our first speaker this morning. It's my pleasure to introduce Rita Cruz Gallegos. She's a provider outreach specialist from Arrera Health Group, and she's speaking on behalf of the California Department of Health Care Services.
Thank you, Carolina, and good morning, everyone. I will be sharing with you some information on the Medicare, Medi-Cal plans and the Cal Medi-Connect transition this morning. Next slide. Some of the topics that I will be briefly touching on is the Cal AIM and dual eligible beneficiaries, the Cal Medi-Connect transition, the Medicare, Medi-Cal plans, or the MMPs, or Medi plans, however we choose to call them. The information, I'm going to share with you some information for beneficiaries. I will not share with you about the public health emergency unwinding. However, I will give you some resources so that you can go to the website and get more information on that. And then we'll talk a little bit about the next steps and your involvement as an advocate, as a provider for this community. How can you continue to stay involved as we move our senior community through this transition? Next slide. Next slide. Great. So the dual eligible beneficiaries, as you may or may not know, and I may be preaching to the choir, are those individuals that are eligible for both Medicare and Medi-Cal. And we often refer to them as our Medi-Medis. Nationally, dual eligible beneficiaries were more likely than non-dual Medicare beneficiaries to report being in poor health. And you can see the percentages on your screen. These individuals were also more likely to live in an institution rather than living at home. In California, almost a quarter of Medicare beneficiaries were dually eligible for Medicare and Medi-Cal. And actually that number just went up a couple of weeks ago. So now we are at a 1.5 million Californians. Of those 1.5 million dual eligible beneficiaries, 43% of them had Medicare Advantage or an MA plan, and 57% had original fee-for-service Medicare. Again, this presentation will be sent to you, so there's a lot of resources, a lot of information. If you don't have anything to write down information, you will be getting this presentation shortly after our event. Next slide. The Medicare, Medi-Cal, and the need for coordinated care. For most dual eligible beneficiaries, Medicare and Medi-Cal operate separately and with different funding streams. Though these two separate programs, Medicare and Medi-Cal, are very rich in benefits, it is a fragmented system, and a lot of times it lacks incentives to provide these often needed individuals with person-centered services. And for the dual eligible beneficiaries that have high rates of chronic conditions or functional impairments, streamlining access to services across the health and long-term services and support system is quite critical. Next slide. So let's talk a little bit about the Cal Medi-Connect transition. The Cal Medi-Connect will continue to be in effect until December 31st of this year. On January 1st, 2023, the beneficiaries in Cal Medi-Connect plans, or in Orange County is the One Care Connect program, they will be automatically transitioned into the Medicare Medi-Cal plan, the MMP or Medi-Medi plan. That is the official name of the program, Medicare Medi-Cal plan. And this will continue to be operated by the same parent company as the current One Care Connect plan. In Orange County, of course, is CalOptima. The goal of the department is that with this transition, that there is no gap in coverage for these beneficiaries. The provider network will be substantially similar, if not the same. There will continue to be a continuity of care provision in the program. And the plans, again, will operate similar to the Cal Medi-Connect or One Care Connect, with care coordination, one health plan card, one phone number for member services for the beneficiary to call with questions on both Medicare and Medi-Cal benefits. Very important to note that these beneficiaries will continue to have the choice to voluntarily enroll in the Medicare coverage of their choice, including original Medicare, Medicare Advantage plans, or the dual special need programs or DSNPs. Next slide. Thank you. The Medicare Medi-Cal plans. As I mentioned earlier, beneficiaries enrolled in a Medi-Medi plan receive their Medicare benefits through the dual eligible special needs plans, and their Medi-Cal benefits through a Medi-Cal managed care plan. Of course, again, in CalOptima, in Orange County is CalOptima. So the DSNP is a type of Medicare Advantage plan that provides Medicare Parts A, B, and D services. In addition, to specialized care for the dual eligible beneficiaries that are also enrolled in the matching Medi-Cal plan. The Medi-Cal plan provides wraparound services, including Medicare cost sharing, long-term services and supports, and durable medical equipment. Both are operated by the same parent company for better care coordination and integration. Next slide. The Medicare Medi-Cal plan transition and new enrollment. In the Coordinated Care Initiative counties, or CCI counties, members in Cal Medi-Connect plans will transition into the Medi-Medi plans on January 1st, 2023. Dual eligible beneficiaries who are not Cal Medi-Connect members or One Care Connect members will also have the option to enroll in a Medi-Medi plan in this Coordinated Care Initiative counties. And these counties are currently in effect, and this program is currently in effect in 7 counties, 5 in Southern California and 2 in Northern California. In Northern California, we have Santa Clara and San Mateo. And in Southern California, we have San Diego, Riverside, San Bernardino, Los Angeles, and of course, Orange County. During the 2022 Medicare annual enrollment period, these beneficiaries will have the choice to select a Medi-Medi plan. Next. Did we go, did we skip one? No, okay. All right. Can you go back one more, please? Thank you. So the Medicare Medi-Cal plan provider networks. The beneficiaries will continue to have access to a provider network through their Medi-Medi plan, which will include similar providers they seek today. Or the Medi-Medi plan will help the members find a new doctor that they like. I want to talk a little bit and explain a little bit about the continuity of care. If a beneficiary's doctor is not currently in their Medi-Medi plan network, there will continue to be a continuity of care period. During this period, the beneficiary has the right to continue to see their doctor for up to 12 months in most cases. What happens during these 12 months? The provider is in conversations with the health plan to, if they're not in the network, to hopefully join the network for the program. And the beneficiary must have a prior relationship with the provider in order for them to seek out the continuity of care provision. This is not for new members, new patients, it's for an existing provider-patient relationship. What happens at the end of this 12 months? Then if the patient's doctor joined the network, then it's great. You know, the patient can continue to see their provider for an unlimited period. If the doctor did not join the network, then the patient has to make a decision whether they stay in the program and the plan helps them identify another provider for them, or leave the program and continue to seek services with their healthcare provider. Next slide. Balance billing, and I'll touch briefly upon this. The dual eligible beneficiaries, people that have Medicare and Medi-Cal, should never receive a bill for their medical services. This is called improper billing or balance billing, and it is illegal under state and federal law. However, they should not ignore if they do happen to get this bill. The process is for them to call the plan, call their doctor, and explain to them that, you know, they have Medicare, Medi-Cal, and they feel they don't have to pay this bill. If they don't get anywhere with them, the health plan or their provider offices, then they can seek help from the ombudsman. And we have somebody here from the ombudsman that will touch upon the services that they provide to these beneficiaries for free. The beneficiaries will not pay a plan premium or pay for doctor's visits and other medical care when they receive services from a provider in their Medi-Cal plans provider network. They may still have a copayment, however, for prescription drugs, but not all the time. Next slide. This is a great comparison chart to show the benefits that the members under the OneCare Connect program or CalMedi Connect program are required to offer the beneficiaries. And all these benefits will transition with the new plan, with the new Medicare, Medi-Cal plan. So the members are not going to go without continuing to receive the great services that they currently receive from their health plan, from their IPAs, from their medical groups. And you can see on your screen, they will continue to have access to all these great services that Medicare covers services, coordination of cover Medi-Cal benefits like long-term services and supports, durable medical equipment, and medical transportation. They will continue to enjoy care coordination, continuity of care, and they will continue to receive integrated materials, one health insurance care, and one member services number to call to make it easier to navigate the program. Next slide. What can you share with the people, the patients that you work with? If a beneficiary is in CalMedi Connect or in OneCare Connect program, they do not need to do anything to enroll in the new Medi plan in order for them to keep their current benefits. As I mentioned earlier, the member, the beneficiary, will be automatically transitioned from the OneCare Connect program into the Medi plan or OneCare in Orange County on January 1st. The beneficiaries will also be provided options for additional Medicare plans to enroll into if they do not wish to be in the Medi plan. If a dual eligible member would still like to enroll in OneCare Connect right now, they can do so up until next month. However, at the end of the year, they will automatically be transitioned into the new Medicare Medi-Cal plan. Next slide. Who can they contact for help? The members can access free counseling on their health coverage by contacting the Health Insurance Counseling and Advocacy Program, a great entity, and I won't expand on that because we have somebody from there that is going to address us later on, but a great resource for the beneficiaries to seek help and counseling for free. They receive the services for free. As I earlier mentioned, if the beneficiaries cannot resolve any issues with their providers or with their health plans, such as the balance billing issue, they can contact the ombudsman. We have the Medicare Medi-Cal Ombudsman Program and the Medi-Cal Managed Care Ombudsman Program that provide free legal services and can help these members navigate the system as well. Next slide. These are some additional resources that you will be getting when you get the presentation. If you want more information about coordinated care for dual eligible beneficiaries, please visit the DHCS Integrated Care for Dual Eligible Beneficiaries website. If you want to know more about the future of CalMedi Connect, that's the state's name program for the OneCare Connect here in Orange County. Again, I invite you to visit the department's website. If you want more information on the DSNPs or DSNPs lookalike, we have a lot of information on the website as well as more information on the CalAIM program. Next slide. What are the next steps? How can you continue to stay involved and informed? At a statewide level, the Department of Healthcare Services holds a monthly work group called the CalAIM Managed Long-Term Services and Supports and the Dual Integration Stakeholder Work Group. This is a group of advocates that are brought together by the department once a month. It's open to the public. However, you do need to register so that you can get the link for you to join the program. We just had the meeting last week. The next meeting will be in the November 16th. So please go online and register if you want to participate. If you want to learn more about policy, operations, and strategy for upcoming changes for Medicare and Medi-Cal. At a local level, I conduct the county-based communication work groups. We meet every month via Zoom. Our next Zoom meeting is on November 16. We meet at 3:30 on the third Wednesday of every month. If you're interested, you will get my information. Just send me an email and I'll make sure that I'll add you to our distribution list. Next slide. That concludes my presentation. Thank you so much. And if you have any questions, put them down in the chat window. And thank you for allowing me to present to you all this morning.
Thank you so much, Rita, for such a wonderful presentation. Our next speaker will be Angel Ruiz. He is the supervisor for One Care Connect Customer Service Department in CalOptima, where he has been for over 6 years. Angel has worked in healthcare for over 8 years. And without further ado, I'll leave you with him.
I don't think we can hear you, Angel.
Can you hear me now?
Yes, thank you.
Thank you. Sorry about that. My name is Angel, and I will be talking to you guys about the One Care Connect transition from the CalOptima Health perspective. Next slide, please. So CalOptima Health manages the Medi-Cal benefits for Orange County. Members with Medicare and Medi-Cal receive their Medi-Cal health services through CalOptima Health. A little bit of background for One Care Connect. The plan did launch in 2015 as a pilot program, and it will be sunsetting in December 2022 and effective January 1st, 2023. One Care Connect members will be transitioning over to the One Care HMO, DSNP, a Medicare Medicaid plan, which is the CalOptima Health's dual eligible special needs plan. Next slide. So our goal for this transition is to have 100% provider alignment. And this will help us support the seamless member transition from One Care to One Care Connect, or from One Care Connect to One Care, I'm sorry, and minimize disruptions to the members' access to care. We are expecting that all existing One Care Connect providers to participate with One Care, including our CalOptima Health Community Network will be an community health network that is offered in 2023 under One Care. Next slide, please. Thank you. So here's what members need to know. Members will automatically move to One Care on January 1st in 2023. Members do not need to do anything to enroll in One Care. Members will also continue to receive their healthcare benefits and will not have a gap in coverage. And members will be notified by mail about the transition in October and will also receive their second notice in November. So the members at this point should have already received the 90-day notice. And on November 14th, we will be sending out the 45-day transition notice to all of our members, as well as conducting outreach calls to every member. So we have an opportunity to answer any questions that they may have during this transition period. Next slide, please. So here's a timeline of what our members' notices and the enrollment timeline will look like. So in September, we did send out the annual notice of change. And in October, we did send out, they actually went out hand in hand, the 90-day non-renewal notice. We are conducting outreaches currently. In November, like I mentioned, November 14th, they will drop the 45-day notices. And in early December, our members will start receiving the One Care welcome packet, which will include their member ID card and additional plan information for them to go ahead and review. And of course, if they have any questions, give us a call. Next slide, please. For anybody who does have any questions or more information, they can contact Tiffany, Manager of Community Relations, and members can contact One Care Connect customer service 24 hours a day, 7 days a week, or visit our website for additional details. Next slide. And it looks like that's our presentation. Thank you.
Thank you so much, Angel. Our next speaker is Sarah Lee. Sarah is currently the supervising attorney of Health Consumer Action Center Unit at Community Legal Aid SoCal, a partner of the statewide Health Consumer Alliance. She's a member of CalOptima's One Care Connect Member Advisory Committee, serving as the Ethnic and Cultural Communities Representative.
Thank you. So we are the ombudsman for One Care Connect currently. Next slide, please. So Community Legal Aid SoCal, we're a legal aid in Orange County. We're dedicated to meeting the legal needs of low-income people throughout Orange and Southeast LA County. However, our health unit focuses on Orange County with an emphasis on innovation, language access, and a holistic approach to client care. We provide the following services. It can be simple as a counsel and advice. We have clinics and workshops to direct representation as their advocates. We engage in impact litigation and policy advocacy stemming from our individual direct legal assistance cases. Next slide, please. Of course, our services are free, and the gateway to our services is our hotline. Next slide, please. We have various units, family law, housing defense. I'm from the health, and we're, like I said, we are also the ombudsman for One Care Connect, so that's one of our roles. But really our role is the same for all of our clients who reach out to us asking assistance on healthcare eligibility coverage to healthcare access, regardless of their health plan, whether it's Medi-Cal, Covered California, One Care, or One Care Connect. And we have a small claims and immigration, economic maintenance, government benefits, and our family law unit assists with domestic violence, and we have a senior unit assisting with elder abuse as well. Next slide. So who we serve. So our target population is mostly low-income residents and seniors. However, there's an exception. We do not have an income limit for our health and senior unit. So there is no income limit. And if you're a senior 60 plus living in Orange County and need help with any legal problems, they're eligible for our services. And like I said, for our health, there is no income limit. Next slide. So our Health Consumer Action Center, short for health, we call ourselves from the health unit, we assist with eligibility. We assist with problems concerning eligibility for Medi-Cal, Medicare, Covered California, private health insurance, and IHSS. Like I said, regardless of what type of health coverage we have, we assist with any kind of issues with eligibility. And also they may have health plan or health coverage, but they have issues with accessing healthcare services regarding such as denials. We assist with denials, barriers, and delays in obtaining healthcare services. Regardless of what type of plans they have. We also represent clients in before state and federal regulators to obtain the healthcare coverage and benefits. Of course, assuming there's merit to their case. Excuse me, I have allergies. And like Rita mentioned, we assist with any kind of billing problems, especially inappropriate balance billing for duals who have both Medi-Cal and Medicare, and also Medi-Cal members, and also inappropriate billings in general. Excuse me, gonna drink some water. And our role is the same as the One Care Connect ombudsman. Currently, we are the ombudsman for this plan. And our role will transition as providing the same type of services for those members who will transition into either automatically transition into One Care, or those who may select to opt out of it. Whatever their coverage type is, our role will be the same in assisting them with any kind of healthcare eligibility, access, and billing matters. And the last one doesn't apply to our Medi-Cal and One Care Connect and One Care members, but this is For those who have covered California private insurance regulated by Department of Managed Healthcare, we assist with those appeals as well. But next slide. So some of our cases we assisted, we restore eligibility for Medi-Cal clients, assist with accessing medical services, durable medical equipment, IHSS, dental services. Recently, we assisted a member access a recliner lift chair, which is normally not covered by Medi-Cal Medicare, but through the community support services, it was covered, and she was able to get that services to stay in her home and avoid being homeless again after her recovery from a surgery. We also assisted with overturn of health plan denials for surgical benefits, any kind of medical necessary services for clients to reach out to us. And actually that number is a lot higher. We save a lot of money, more than that. We help clients with any kind of inappropriate medical billing. And these are just some of the cases we have, examples of cases we handle. Next slide. And once again, that's the gateway to our services, the hotline. And I think this is the last slide. So I think that's it on my end. Thank you.
Thank you so much, Sarah. Just a reminder to submit your questions for the speakers in the Q&A box at the bottom of your screen. The Q&A will be held after the last speaker. And with that said, let's move forward to our next speaker, Nicole Garcia. Nicole is a licensed licensed marriage and family therapist and the director of CalAIM Outreach at CalOptima Health.
Hi, thank you, Carolina. My name is Nicole Garcia, as she shared. I'm excited to share a little bit about CalAIM, specifically enhanced care management and community supports. As a provider, it was so exciting to hear and see that CalAIM was rolling out, you know, as much as physical health visits and dental visits, those are all very important. But when we look at the whole person, we see that our Medi-Cal members could use a lot more help than just those things. So it's been very exciting to onboard providers and roll out these services. Next slide, please. So just a CalOptima Health overview, we recently did change our name and logo. So just to share a few facts about us, I think it's important to know we're at 1 in 4 adults and 1 in 3 kiddos in Orange County. And really, we redid our mission statement as well, as to serve member health with excellence and dignity, respecting the value and needs of each person. Next slide. So CalAIM goals, what are they? If you look on the state website, they have some very specific goals that are on the PowerPoint slide. I'm not going to read them to you since you're all capable, but I wanted to just share from my lens the goal that we have here on our CalAIM team. We're small but mighty, the 5 of us here at CalOptima Health. We just want equitable care for members. We want it to be smooth when they need to access services. We want to, like I said, treat the whole person. So really look beyond their physical needs and dental needs to how can we help them progress in life. We want to reduce health disparities, and we really want the quality and level of service that we provide to be something equitable and similar to what you and I receive through our, private health insurance that we have. We really want that quality to be there for our members. Next slide. So enhanced care management is one piece of CalAIM. And a side note, CalAIM is such a large initiative and has so many goals and arms to it, so to speak. So I'm just going to be focusing on 2, but I didn't want to pretend that it's just these 2. A lot of great pieces of CalAIM, but this is specifically what I'm going to focus on. So next slide. Enhanced care management essentially is a whole person care approach. A lot of providers who do what we know to be case management, similar, right? Similar but different. It's more extensive than that. It's folks that have really high needs, not just clinical needs, but they have complex medical situations, complex social situations, maybe experiencing homelessness, be towards the later later stages of life, things like that. And so when you think of case management, think of it broader than that. It's really wrapping around services, people making sure that you're coordinating all the things that they need. Next slide. This is a great visual that we like to use at ECM. So in the middle, you have your member that has enhanced care management, and then all around it is the services involved in enhanced care management. So like you'll see, some of the pieces are what we think of when we think of traditional case management. As a therapist, you know, I definitely did assessments and care plans with people, but it goes beyond that and really looks at coordination of services. It looks at looking at their family as well. How are we helping the whole person, promoting their health, again, not just for physical health, but their health in a very holistic way. In terms of ECM, who's providing it, currently with CalOptima Health, we have it with our health networks, but in the new year, we're looking to expand to have additional providers, because here in Orange County, we're really lucky to have a lot of great CBOs and organizations that help these specific populations of focus that qualify for currently and will continue to roll out to qualify for. Next slide. So I mentioned populations of focus. This is just a helpful visual how enhanced care management is rolling out. It is by population of focus. So these groups of folks that the state identified, that's who's eligible for enhanced care management. So you can see in the top flag, we call them flags, in the top flag that there's folks that are already eligible and receiving enhanced care management. Come the new year, like I mentioned, we're going to expand and have even more providers, but there's also going to be more eligible populations. And then come July 1, even more. So, and of course, as we all know, we get updates all the time to this project, this program, what's happening, the timelines and such. So right now, this is a picture of what we have. Next slide. Community support. So the second leg that I shared I was going to talk about is community supports. Next slide, please. Okay, so before I jump into this slide, I just kind of want to lay out, there are 14 community supports that the state said that insurance plans could offer. CalOptima Health is very proud to be offering all 14 in a phased approach. You'll see here with the dates and what's currently available and then what's coming. So I'm going to jump briefly into each of the services. But I think regardless of what population of focus or who you serve on a day-to-day basis, it is so exciting to know that Medi-Cal members are now eligible for these services. And again, here in Orange County, we believe that health is housing, health is housing, food is health, recovery is health, all these things. So what went live at the beginning of the year were 4 community supports. We have recuperative care, which when you think of individuals at risk of or experiencing homelessness, when those individuals get out of the hospital, they're not like you and I. They're not going to go home and have family members take care of them. They might not even have a roof over their head to go home to, and they're not going to recuperate well without meals, a bed, a roof over their head. So hence recuperative care. It's an option for them to get better and recover further once they discharge from the hospital. And also the housing support. So we see them as a continuum, so to speak, because if you have an individual that's experiencing homelessness or at risk of homelessness, they use HUD's definitions. They kind of need to go through this process of navigating what's out there, making a housing plan with their provider, and then, enacting that plan. Once they are able to find placement, maybe through a voucher, maybe through getting a job, whatever that looks like, there's this one-time benefit of $5,000 to help make their house a home. We really want them to be successfully placed in this housing placement. And sometimes when you're coming from the streets or a shelter, it's difficult to feel isolated in a home. And we really want to use that money to help individuals make their house a home. And also couple that with tenancy and sustaining services. So support for these individuals. Maybe what barriers are they feeling to being housed? Maybe they don't know how to get along with the landlord, pay their bills on time, things like that. So these housing services really help folks through the continuum of being housed. Next slide. Next, in January, we had the next set of supports go live. We have short-term post-hospitalization housing, which can be seen as a continuum of recuperative care. You can be exiting more than just recuperative care, but again, it's those members that that don't have a residence and have high medical or behavioral health needs that still need some support and oversight while recovering, and also hopefully navigating housing and what that next step is going to be. There's also day habilitation programs, so helping members with social skills, job skills, maybe daily life skills that can really, again, help them kind of become more independent, possibly get a job and really get on their feet. Personal care and homemaker, this is where kind of our senior population comes into focus. Of course, we also have seniors experiencing homelessness, unfortunately, but this one kind of screams the older adult population to me. So, you know, if you've had experience with a loved one who's very sick and possibly ill, you know, this is what we think of. My dad had cancer, and we had to have someone come into the home eventually and take care of him. And that's such a luxury. It's usually an out-of-pocket service, but it's so exciting to know that Cal-Aim Community Supports, this is now going to be a covered benefit. So for members that qualify for, applied for, need more of in-home supportive services, this is kind of helps with the wait time when applying to bring people into their home to help with ADLs and various support that they need. We also have meals, medically tailored meals. So this is folks that have a medical condition. I use that term really loosely because we're trying to be as flexible as possible. It doesn't have to be some terminal medical condition. It could be diabetes or high blood pressure, and that they can get meals delivered to their home, 2 meals a day, or grocery boxes to really help them. We know that food leads to health, right? So that's one of the benefits. And then the last benefit that went live in July is sobering centers. So again, I keep going back to when you and I experience things, because again, there's that inequitableness, especially for those experiencing homelessness. You know, if we have too much to drink, we're going to come home and sleep it off. For those experiencing homelessness or between homes or at risk of homelessness, perhaps they're going to get taken to the emergency room, or perhaps they're going to be taken to what's called a drunk tank. Don't like that term, but people seem to know it. This is a different option. This is a place where people can safely sober up. They can get some snacks and hydration and have some oversight and make sure that they sober up. But also we're going to take that opportunity to see what other referrals and what services we can link them to. Next slide. And last but certainly not least, we have community supports coming live January 1st. We are working very fast and furiously here at Cal Health to get them live January 1. So again, this definitely has a more aging population feel to them, but not limited to that population. We have respite, again, usually seen as a luxury to be able to have someone come into your home and help care for someone who needs it. But this can be now a Medi-Cal benefit come January, respite services. Home modifications. Again, this is, you know, perhaps people have to go into nursing facilities or outside of their home because they can't do something to their home, like get grab bars or widen a door or put in a ramp. Well, now there's a benefit, $7,500, that members can get to make these improvements and hopefully help them stay at home. In the orange, we have our transition services. So those are really just complicated way, I think they're the lengthiest names of the community supports, of saying transferring to different levels of care or diverting from different levels of care. So we're looking to move people back into the community, back into their home, or to a lower level of care. And these are services to help individuals do that. Again, it might be, okay, so now home modifications are realistic. I can get mom and dad home so long as we do these few things to adjust the house. And lastly, in the green, we have asthma remediation. So for individuals who have severe asthma, it could be that something in their home environment that could easily be fixed, but maybe perhaps they don't have the resources to fix those things. Now this is a benefit, will be a benefit in January. So perhaps it's air filters, perhaps it's pulling up some carpet that's old and that's causing, you know, kind of their lungs to get irritated. Things like that are another benefit that will go live. Next slide. Next slide. So referring people, how do you refer people to these services? I am going to share that there's currently a referral form on the website. It is being revamped. The workflow currently right now is that you have to send it to the members health network. We want to simplify that and centralize it so you're just sending it to us or Kaiser if they're a Kaiser member. And so it's on there currently on our website, and anyone can make referrals, even the member themselves. But please note that we are simplifying it, but you can find it online. There's referral forms for ECM. There's referral forms for the community supports. Next slide. You can also call providers. So perhaps providers of these services. We have them on our website, or you can always ask us and make direct calls to providers and they can input the referral for themselves. Next slide. And we just wanted to share, the state's website has great information. The policy guide for community supports is my Bible. I hope I mean that very lightly. I don't mean to offend anyone, but truly I carry it with me everywhere. In every new version, I'm re-highlighting it. It's a great overview of the services. And also we have a website on CalAIM as well that's also being refreshed. So we're here, we're ready to serve members in these new ways. And thank you. So it looks like maybe I'll take a question. I'm sorry, I do have to go because we are so busy launching phase 3. Was I going to take a question now? Yeah. Okay.
Good morning, Nicole. Thank you
Hi.
so much for presenting on CalAIM and community supports. We do have the Q&A portion at the end. However, I understand that you have to leave early.
I do, sorry.
And so not to worry, we understand there's competing priorities, but we do have a question specific to CalAIM's community supports.
Sure.
Sandy, her question is, are the personal care services available on a full-time basis and for how long? Also, is this just California or provided in other states? If you could answer that question before you leave.
Sure. So the second one first, CalAIM is California Advancing and Innovating Medi-Cal. So this is an initiative from the state of California. To be honest, I'm not sure if there's initiatives in different states, but what we're speaking of, CalAIM, is specific to California. And then for personal care, it's not indefinite, it's not forever, it's more looked to as a bridge for in-home supportive services. So when members apply for in-home supportive services, our understanding is it could take up to 100 days to hear back. Well, if you're coming out of the hospital, it might be the difference between going home and going to a facility if you need personal care. And so we'd really love to bridge that gap with personal care. And then once in-home starts, that's the benefit, right? There shouldn't be a need for personal care to continue. On the other side of that coin, though, sometimes personal or in-home supportive services start, and then maybe the member has a stroke or a health issue that raises their level of care needs at home. But when you reapply for a reassessment, it's another 100 days. So it can also be used to supplement that in case that kind of situation happens. So I hope that answers both questions. I appreciate everyone's time. Thank you so much. And our emails are here if we can be of any support.
Fantastic. Thank you. And we'll revisit the other questions in the Q&A portion at the end. Thank you, Nicole.
Thank you so much, Nicole, and thank you for staying another 5 minutes to help us answer questions right now. It is my pleasure now to introduce our final speaker, Linda Cardoza. Linda serves as the director of the Health Insurance Counseling and Advocacy Program at the Council on Aging in Southern California. Linda and her team of 50+ state-registered HICAP counselors provide no-cost, unbiased Medicare and related insurance counseling, assistance, and education to Medicare beneficiaries, their families, and caregivers across the county.
Thank you, Carolina. And good morning, everyone. Thank you for joining us for this session. You've heard about some of the transitions and changes that are going to occur as we move from this year into 2023 from a Medi-Cal perspective. So I'm also going to be speaking about some of the changes and transitions, but more from a Medicare perspective. But once again, it's very specific to our dual eligible population, our Medi-Medi beneficiaries. Next slide, please. So for those of you that may not be familiar with HICAP, even though you've heard a little bit about our program from a couple of the other panelists, you may not be as familiar, so I'd like to just spend a minute talking about our program and our services. HICAP, Health Insurance Counseling and Advocacy Program, is available in each of the counties of California, and we are actually part of a nationwide network of SHIPs, SHIP, which is State Health Insurance Assistance Programs. So if you ever take a look at material coming in from CMS, the Center for Medicaid and Medicare Services, or any of the Medicare plans, you'll see that there is language that states that if anybody needs local assistance, to contact their SHIP. Here in California, SHIP is called HICAP. So the counselors provide free, unbiased counseling. We also provide group webinars and in-person seminars, education sessions, workshops for individuals that may not be familiar about Medicare and would like to learn a bit more. Services are available in English plus 5 threshold languages: Spanish, Vietnamese, Chinese, Korean, and Farsi. And then we do have a few other languages depending on the bilingual counselors, such as Russian or Gujarati. So the counselors will assist individuals with any type of Medicare related question. So it could be somebody that's brand new to Medicare. It could be somebody that has been on Medicare for many years and has run into a billing issue or has become, unfortunately, a victim of Medicare fraud. So anything related to Medicare, we do work with Medicare beneficiaries on those issues. The one thing I do want to emphasize is that HICAP counselors are not insurance agents or brokers. So we do not sell insurance, and we are not allowed, and we do not endorse or recommend any specific insurance product. Next slide, please. So as we look at Medicare, and we know how complicated it can be, and before I talk a little bit about the changes and the transitions that are going to take place, because once again, we're talking about Medicare, Medicaid, or Medicare, Medi-Cal beneficiaries, I do want to just lay a little bit of a groundwork, a little bit of a baseline on the Medicare side. So for any Medicare beneficiary, they can receive, and they choose to receive their Medicare coverage one of 2 different ways. One is Original Medicare, which is the first column, the blocks that you see shaded in the orange color. And sometimes you'll hear Original Medicare referred to as Traditional Medicare or Fee-for-Service Medicare. The other way an individual can receive Medicare coverage is through a Medicare Advantage plan. So let me just start with Original Medicare. So the individual has Part A, which is hospitalization. Think about the services one receives as an inpatient, whether it's a hospital or a skilled nursing facility. And then Part B, which is all other. It's the medical coverage. It is anything on an outpatient basis. The individual can then purchase separately a prescription drug plan, a Part D plan. And for the purposes of today, since we are talking about the dual eligible population, the secondary coverage is Medi-Cal. So these are individuals that are Original Medicare, they're fee-for-service, and then we have individuals that receive their Medicare coverage through a Medicare Advantage plan, Part C. And these are bundled plans that includes the Part A and the Part B benefits that we just spoke about under Original Medicare, all except for hospice, which is handled a little bit differently. And for the most part, for the Medicare Advantage plans that are here in Orange County, all but a few also include prescription drug coverage. So they're bundled plans. The individual has one insurance card that covers their A, B, and their prescription drug benefits. And also similar to Original Medicare, the secondary coverage is Medi-Cal. So for an individual, a Medi-Medi individual, dual eligible, that is covered by Original Medicare. And let's say they want to, they choose to continue as we move into next year to receive their Medicare coverage via Original Medicare. The one area that they need to take a look at, and this applies across all beneficiaries, but certainly for our Medi-Medi population, is at the very least, they need to take a look at their prescription drug plan to ensure that they're not paying more for this coverage than they really need to pay, but also to make sure that the plan they have is a zero premium plan. So a beneficiary that's covered by Original Medicare, take a look at Part D. We are in the midst of open enrollment right now, Medicare open enrollment, which began about a week ago. So this is the time for these individuals to review their plans for a potential change. Do they have to make a change? No. Can they make a change? Yes, if they so wish. On the other side, with the blue shaded boxes for Medicare Advantage, this one's a little bit more complex because it's not only looking at just prescription drug coverage and making sure that they have the right coverage for themselves, but it's also really understanding the network of providers. It's also looking at the numbers of plans we have in the county and what the benefits are. So you have the basic benefits, and a lot of these plans offer a lot of extra benefits. We hear a lot about that in the various advertisements that people see, especially on television, and that draws a lot of people to these benefits. And so that also increases the call volume we experience as people look to see whether or not it makes sense for them, for that individual to change plans. Next slide, please. So in talking about Medicare Advantage plans, there are quite a few plans available to individuals here in Orange County. For next year, there are over 100 plans, Medicare Advantage plans. These plans are grouped or segmented into major categories. And this is where there's a little bit of confusion as individuals look at their plans. They may or may not know that they have an HMO and whether or not that's a Medicare Advantage plan. So these are the types, the major types of Medicare Advantage plans that we have in Orange County. Now, this may not be the same in other counties, certainly not going to be the same in other states. These are the ones that are specific to our county. So a PPO, preferred provider organization, allows plan members to seek care outside of the plan's network, but they are going to have increase in cost sharing. So for our dual eligible, our Medi-Medi population, this is rare that an individual would be enrolled in a PPO. However, the next one, the HMO, the Health Maintenance Organization, and this is where a plan member is assigned a primary care physician who then coordinates that patient's care and provides referrals to specialists when it's necessary. The majority of our population here in Orange County that are Medi-Medi have an HMO. They're within that type of Medicare Advantage plan. New to Orange County, we have one plan this year, and we'll have another 5 or 6 as we go into 2023, and that is an HMO point of service plan. And this is really a hybrid between an HMO and a PPO, but it works a lot more similar, or it's nearer in comparison to an HMO than it is a PPO. But it does allow an individual that's a member of that plan to go out of network for very specific services, and it really depends on the plan. So next year, we're going to see one specific insurance company where most of their plans that are offered here in Orange County will be HMO point of service plans. And then we have special needs plans. So you heard a little bit about that earlier from a different panelist. And these are special needs plans, SMP or SNP, special needs plans that will limit membership in those plans to people with specific conditions, diseases, or characteristics. And the benefits for these plans, or the benefits that are included in these plans, tend to be tailored to address the specific needs of the individuals that the plans serve. So there are 3 major types of special needs plans. One is what we would call a CSNP, a chronic special needs plan. And this is for individuals that have chronic conditions and they meet the requirements of that plan. So chronic conditions could be diabetes, they could be cardiovascular disorders, dementia. A second type is known as an ISNP. This is an institutional special needs plan. And these are for individuals, or it's restricted to individuals that need a level of service that's provided in a long-term care facility. It doesn't mean they need to reside in that facility, but it's a level of care that these plan members require. And then the third one, which is going to be new as we go into 2023, these were in place prior to 2015. And then as we moved into Cal Medi-Connect as part of that pilot program, as part of the demonstration, these were placed on hold. But there are DSNPs that will be available as we go into 2023. Not very many, it's just a handful. And these are very specific to individuals that are covered by Medicare and Medi-Cal, full scope Medi-Cal. So there's a lot of different choices that are available to beneficiaries, which is wonderful from seeking options and being able to get maximum coverage, but it can also be very overwhelming, just looking at the sheer numbers of plans and then looking at the types of benefits and trying to understand what benefit makes the most amount of sense and what plan makes the most amount of sense and best meets the needs of that individual. So with that groundwork, let me, next slide, please. So with that groundwork, let's just talk a little bit about what's going to happen as we move into 2023. So you've already heard about the transition of members that are in OneCare Connect that are going to be transitioning to OneCare. So OneCare Connect expires at the end of the year, and then OneCare is effective January 1. So you've heard quite a bit about it. I'm not going to spend time on that particular transition. There is another transition that is taking place that affects dual eligible, the Medi-Medi population that we have here in Orange County. It doesn't affect all, it only affects those that are members of certain Medicare Advantage plans. And this is going to be maybe a new terminology. You may or may not have heard of this. And these are plans that have been termed DSNP, dual special needs plans, lookalikes. They're not true DSNPs, but they look like a DSNP. And these were heavily marketed to dual eligibles. And so CMS, a Center for Medicare and Medicaid Services, are not going to renew. They're not going to continue these plans as we go into the new year. So that also means any of the members of those plans need to be crosswalked. They need to be mapped to a new plan. That crosswalk has already taken place. The mapping has already taken place. And CMS, Center for Medicare and Medicaid Services, worked with the various plans to help facilitate that crosswalk. So individuals in the plan, whatever that plan is this year, and it was deemed to be a lookalike plan, these individuals have already been mapped to the new plan, which could be another Medicare Advantage plan, and it could be just a regular Medicare Advantage plan, or it could be one of the special needs plans. That mapping is complete. And it would have been with the same parent organization that housed the DSNP lookalike plan. So if it was company A that had a lookalike plan, then they would have crosswalked the plan members in that plan into another Medicare Advantage plan with that same company A. There's one exception that we've seen as we go into 2023 where a plan or a company does not have another plan to crosswalk or map the folks into. So they are being mapped or crosswalked to original Medicare. And that is a very, very small number of folks. So the transition from these lookalike plans to their new Medicare Advantage plans were designed to ensure continuity of care. We want to make sure that everyone does not lose that continuity, as well as cost sharing protections, no cost to these individuals. The individuals were notified with their annual notice of change, their ANOC, which was sent out to plan members last month. So we have started receiving a few calls from individuals that are just trying to understand what does it all mean. So if, as you're working with the individuals that you serve, just let them know that there's help. They can ask questions if it doesn't make sense to them. This is the time, as I mentioned, that we're in open enrollment, so individuals can review their plans if they want to make a change going into next year. Next slide, please. So if we've talked about the annual election period, Medicare open enrollment, there's different terms that are used for that. So that ends on December 7th. So if an individual is looking to make a change, if they were mapped into a plan, let's say that they really don't want to be a part of, this is the time to review their options and then to process a change. And that would be effective January 1 of the new year. If for some reason a person that's in a Medicare Advantage plan and they totally miss open enrollment, the one we're in right now, they do have another opportunity beginning in January. It's a 3-month opportunity known as the Medicare Advantage open enrollment period. And the key there is the individual must be in a Medicare Advantage plan on January 1. Then they can make a change if they so choose, and that change would be effective the following month. For individuals that are Medicare, Medi-Cal, and our extra help recipients, which the most of our dual beneficiaries are, there is what we call a special enrollment period. These individuals can change plans outside of the key, outside of the annual enrollment period or the Medicare Advantage open enrollment period. And these individuals can make a change once each of the first 3 quarters, and the change would be effective the following month, or they can wait until fall open enrollment, which is annual election period, and then the change would be effective January of next year. So even though a person forgets or doesn't take advantage of open enrollment, they do have an opportunity to make another change. They just need to either contact an organization that will help them, such as HICAP, or it is whomever they normally work with in looking at their plans and coverage. Next slide, please. One of the things about open enrollment during this period, and anytime when there's periods of change, periods of transition, it is also an unfortunate time when scams occur, where individuals just unbeknownst to them even, where they may become a victim of fraud. So one of what we always ask individuals is just be wary that if you hear about something that sounds like it's too good to be true, there's a good chance it probably is. And to be wary of anybody, whether it's a family member, it's a friend, it's a neighbor, and yes, that happens across the board, or it's an agent or a broker. Don't feel like you have to be, don't feel pressure to change plans or to join a plan you don't want to enroll in. And that's really important that individuals know this. There are, if you open, you turn on the TV, you'll see a lot of third-party marketing organizations, and you hear different celebrities talking about get all the benefits you deserve. If you don't have a Part C Medicare Advantage, you need to join one. Look at all of these benefits. But what they're not real clear on some of these advertisements is that it could be regionally based, and it may not apply to beneficiaries in our county. And that's why we ask individuals to at least do your research, do your homework, ask for help. If you're looking to change, if you're looking to review and potentially change plans, ask the questions first and be very, very leery with these advertisements when you call, because the person on the other end of the line is more than likely going to be a broker, and they will and can enroll you. CMS, the Center for Medicare and Medicaid Services, is cracking down on some of this. They've put more and more restrictions in place so that they're monitoring what is in fact taking place, because we've heard too many situations when beneficiaries are in a plan that they claim they did not enroll in, and it doesn't meet their needs. It could be that a provider is not in that network, but whatever reason, they didn't know they were changed. And this is where we then would work with individuals and get them into the plan. First of all, we have to do a little bit of investigation, but we definitely want to make sure that they have access to the healthcare they need with the providers they need, and that they've got coverage for that healthcare. Next slide, please. And this is our contact information, the statewide number, the 800 line is statewide. So if anybody dials that, regardless of the county they're calling from, it will route the call to the appropriate county. The 714 area code number is our local number. We are based, our main offices are in Irvine, and we do take in-person appointments. The majority still is by telephone. We do have a call bank or a call center that can address any of the questions by phone. But at the very least, we want to make sure that people understand and know that there are resources available to assist them, especially on the Medicare side, and especially this time of the year, as we're looking at these changes, as we're looking at transitions, and people are assessing what their needs are as they go into the new year. So with that, I'd like to thank you for listening and return the virtual platform to our moderator, Tiffany.
All right, thank you so much, Linda. Thank you. That information was extremely helpful. We really appreciate it, especially when we think about, well, older adults and people with disabilities. I mean, healthcare is very confusing. And when you think of Medi-Cal and Medicare, it's almost as doubly confusing. So thank you so much for synthesizing that information and really sharing sort of the nuts and bolts of Medicare and how it relates to Medi-Cal and Medicare for the One Care transition. With that, this is an opportunity for all of you to ask questions of our panel. So let's invite back our panel presenters, Rita Cruz Gallegos with Aurora Health Group on behalf of DHCS, Angel Ruiz with CalOptima Health, Sarah Lee with Community Legal Aid of Southern California, Linda Cardozo, who recently spoke to us on the Council of Aging. Nicole's unable to join us right now for the Q&A portion. But this is your time. This is an opportunity for all of you who are the community stakeholders, advocates, family caregivers, and community members to ask questions of our panel presenters. And then, you know, it looks like I'm having an issue with my technology. So let me just do this real quickly. I'm still the invisible lady. I apologize. I was on camera a little while ago, but it looks like something happened with technology. However, you can all still hear me. And the first question we have is related to Medicare. So this may be related to Linda Cardoza or even Angel, given it's the One Care Connect program. If you have long-term care Medicare and had a stroke, for example, if you recover to be released from the nursing home, how long does this coverage continue? So it sounds like a question related to Medicare coverage. If either of you want to respond to that question.
Hi, Tiffany. I'll start and then turn it over to Angel. So with Medicare, Medicare does not cover long-term care. So when I saw the question, I was thinking maybe this was more of a Medi-Cal question. So I would invite either Rita or Angel or even Sarah, if you could maybe articulate a little bit better what the Medi-Cal coverage would be for that.
So from a One Care Connect perspective, coverage will continue with an authorization, of course, meaning medical necessities. For that, to give you a specific answer, of course, we would need to review the specific member, but as long as the member does meet the medical necessity, coverage will continue as long as they continue to meet that requirement.
All right, any other responses from the group?
Just to add, the long-term care or long-term support services, that would be all covered under Medi-Cal, that it is a Medi-Cal covered benefit.
All right, thank you very much. And there's another question from Sandra Zimmer. I believe it would be the same response, but if you have long-term care Medicare and had a stroke, for example, if you recovered to be released from the nursing home, how long would the coverage continue? And then do you have to renew every 100 days? These are all questions from Sandy Zimmer, if the group wants to respond.
I think that's Angel covered that answer, so long as it continues to be a medical necessity, the benefit will continue to be covered by the plan.
I think you might be referring to Medicare. Medicare covers that 100 days stay at the skilled nursing facility, and once that 100 days is up, a lot of folks at that point apply for, if they're eligible, apply for Medi-Cal. So I don't know if that's where she's asking, but folks, please feel free to chime in. I think that's where she's getting the 100 days, but after the, is it 99 or 100 days after Medicare covers, that's when I see a lot of folks applying for Medi-Cal, or prior to that, applying for Medi-Cal to get that long-term support services covered.
All right, thank you, Sarah, for providing that perspective, knowing that you are the ombudsman and oftentimes answering questions or services and benefits related to both Medicare and Medi-Cal. There is a question here from Sandra regarding, this sounds like it's CalAIM Community Supports. Unfortunately, Nicole had to leave. The question is, have you found it to be more effective to give the 5,000 for housing at one time, or is it better to give it over a short-term period of time? Is it paid to the recipient or the landlord? So I will bring that question back to Nicole. However, I think the general response would be that we are trying to be flexible in terms of the one-time 5,000 deposit. One situation that was shared with me is that we were able to even fly home a member back to the East Coast to reunite with their families. So although there are specific guidelines regarding the community supports and housing, at the end of the day, I think the goal is to ensure that families are reunited, and also we are addressing housing issues. So I think as Cal Optima Health, we're trying to be as flexible as possible, knowing that homelessness is a huge issue for Orange County residents and specifically for our members. All right, so let's see. We do not have any more questions really in the Q&A panel here. I do want to open it up to all of you. This is an opportunity to ask specific questions related to any of the information that was shared today as it relates to the One Care Connect transition, services provided by Community Legal Aid and the Ombudsman services, health insurance counseling that was shared by Linda Cardoza, or even from Cal Optima Health. All right, well, it doesn't look like we have any more questions. Again, I want to just thank all of our esteemed panel of presenters for lending their expertise. We recognize that healthcare is very confusing, and being able to share with our community stakeholders the updates and transitions as it relates to Medicare and Medi-Cal. This concludes today's webinar, and as a reminder, we just want to share that the resources will be provided 7 to 14 days after the webinar. So on behalf of OCHI and Orange County Strategic Plan for Aging Healthcare Committee, we want to thank you for attending today's webinar, and we hope you all have a wonderful day. Thank you so much, and take care.